COVID-19 cases in Malawi are on the rise. Local hospitals are now on the edge as the country is hit with the second wave of the pandemic. In Blantyre, South Malawi, the Queen Elizabeth Central Hospital has turned at least 5 wards for treating other illnesses into COVID-19 wards.
These tents, they are not meant for people to be admitted. People are supposed to be admitted in 1A, ENT, 3A or pediatric. But because of the increasing of numbers, people were being admitted here.
It's a stretch for frontline health workers who've been braving the odds to help save lives. Africanews learned some COVID-19 patients have to wait for a couple of days to get a bed. Last week, Doctors Without Borders, along with other partners, built another ward in a tent on the hospital ground for the patients.
Of late, we have seen that when most of our patients who are COVID positive, they spend maybe a day or two awaiting the ward to be free. So they may spend, COVID positive patients may spend a couple of days because in our wards they are almost always full.
Activists are calling on the government for help. The health minister urges Malawians not to despair.
Our availability of oxygen and equipment is not adequate, and maybe patients have been asked to buy. It's an area which government they need to look into that, because the economy has gone down, economic activities haven't gone much. And Malawians, I think if you look at their ability to pay for health services, it's almost zero.
Malawians, they should not be afraid. There's no need to be afraid. There's no need for us to despair. No. There are a lot of people, a lot of Malawians who are coming out of the isolation center on a daily basis, fully recovered and COVID negative.
Malawi is set to roll out its first round of the AstraZeneca vaccines to about 3.8 million people in about a month. The figure represents 20% of the country's 18 million population.